let's talk about neoplasms of the breast. It may be benign or malignant. Benign includes epithelial like adenoma, duct papilloma, connective tissue like fibroma, lipoma, and mixed like fibroadenoma and fibrous tumor. Malignant includes primary or secondary. Primary includes epithelial origin like duct carcinoma, which is 90%, ductal carcinoma in situ, invasive ductal carcinoma, lobular carcinoma in situ, invasive lobular carcinoma, and connective tissue origin fibrosarcoma. Secondary includes from opposite breast or lungs, pleura and chest walls, and even from other sides of the body. Now, classification of fibroadenoma. Gross includes soft, which is common after 30 years, more cellular and often bilateral. Hard, which is common below 30 years and more fibrous. Giant, which is more than 5 cm in size and common in Africa. Microscopic includes pericanalicular or intracanalicular. Pericanalicular is small and hard and mainly fibrous. Intracanalicular is large and soft and mainly cellular. Now, clinical features. It usually occurs in the upper outer quadrant but can occur in any part of the breast. It presents as painless lump in the breast, usually smooth form, non-tender, volatilised, and moves freely within the breast tissue. The sleeping sign is positive, and they usually grow to up to 2 to 3 cm in size and are surrounded by a well-marked capsule. Investigations include FNEC, mammography, ultrasonography, and MRI if necessary. Treatment. In a patient under 30 years and size of the lump lesser than 3 cm, it can be left alone with regular follow-up with the USG at 6-month intervals. Surgery, excision through a circumareolar incision or submammary incision under GIA. Indications of surgery, size more than 3 cm, multiple, giant type, recurrences, osmosis, and complex type. Now, pilous tumor or serocystic disease of the Brody or cystosarcoma pilus. It is a benign tumor of the breast and usually occur in the women over 40 years of the age, but can occur in younger women also. It is large and sometimes massive tumor with an unevenly bosselated surface. Occasionally, ulceration of the overlying skin occurs owing to the pressure necrosis, and despite their size, there remain no mobile in the chest wall. Treatment. Enucleation or wide local excision, mastectomy, massive tumor, recurrent tumor, or malignant type. Now, clinical classification of the carcinoma of the breast. Serous, which is the commonest type, atrophic serous carcinoma, medullary carcinoma, inflammatory carcinoma, lactating carcinoma, or mastitis carcinoma metastasis, colon carcinoma, package disease of the nipple and lobular carcinoma in situ, tubular carcinoma, lipomatous carcinoma, disease of the reclus. Now, sites of carcinoma of breast. Upper and outer quadrant 60%, upper and inner quadrant 12%, lower and outer quadrant 10%, lower and inner quadrant 6%, and central is 12%. Now, breast mouse. Fibroadenoma is also known as breast mouse due to its free mobility. Giant fibroadenoma, when lump is more than 5 cm in diameter. Inflammatory carcinoma of the breast. This is an aggressive type of carcinoma of the breast and is found in pregnant or lactating. There is swelling of the whole breast with redness of the overlying skin, and often this lesion is confused with breast abscess. However, the differentiating features are the absence of the fever and presence of the skin changes like POD orange. Sporadic breast cancer. A breast cancer patient with no family history of the breast cancer in 2 generations, and the incidence is about 68%. Familial breast cancer. A breast cancer patient with a positive family history of the breast cancer in first or second degree relatives, no definite mode of inheritance, and the incidence is 23%. Hereditary breast cancer. A breast cancer patient with a positive family history of the breast cancer and the related cancer like ovarian or colonic cancer in the family, highly penetrating autosomal dominant mode of the inheritance, increased incidence of the bilateral cancer, increased incidence of the multiple primary tumor, and incidence is 8%. Now, etiology of the breast cancer. Exact cause is unknown, but the predisposing factors include geographical, mostly in the West world and rare in Japan. Age includes extremely rare in the less than 20 years, and risk increases with age. Race, white is most predisposed. Gender, less than 5% occurs in male. Genetic, common in the women with the positive family history, and more mutation of the gene BRCA1 and BRCA2, and occasionally BRCA3 and P53 suppressor gene is also involved. Diet, low in phytoestrogen, excessive alcohol intake. Endocrine, common in nulliparous. Personal history of the breast cancer. A woman who has breast cancer in one breast has a risk of cancer in another breast. Previous radiation, delayed child, and obesity. Alcohol intake, early menarche and late menopause, post-menopausal women who take hormone therapy. Now, routes of the spread of the carcinoma of breast. Local spread includes pectoral muscles, chest wall and skin, lymphatic metastasis, axillary lymph nodes, internal memory chain of the lymph nodes, supraclavicular and contralateral lymph nodes. Spread by the bloodstream, bones, lumbar vertebra, femur, thoracic vertebra, ribs, skull, lungs, pleura, soft tissue, liver, brain, adrenal glands and ovaries. Now, target areas of the metastasis of carcinoma of breast with their possible findings. In case of lymph node, axillary supraclavicular lymph nodes are enlarged, skeleton backache, reduced spinal movement and pathological fracture, lungs, pulmonary consolidation and collapse, pleural effusion, dyspnea, liver, palpable and nodular, jaundice and ascites, skin, multiple hard nodules, brain, neurological signs and symptoms may be seen. Now, staging of the carcinoma of the breast is either by TNM classification or international TNM classification. N is for node, M for metastasis. Now, Manchester classification. Stage 1, there is organ confinement. In stage 2, there is loco-regional confinement. In stage 3, there is locally advanced tumor. In stage 4, there is advanced carcinoma with distant metastasis. Now, this is a practice test for staging. A lady of 60 years old presented as cancer right breast, stage T2 N1 MO. Explain this staging. Now, if there is T2, it means 2 to 5 cm diameter or lesser than 2 cm with tethering or nipple retraction. In case of N1, it means mobile palpable axillary nodes, and M node means no evidence of the distant metastasis. So, what do you mean by T3 N1 M1? It means that the T3 means the tumor is 5 to 10 cm in diameter with infiltration, ulceration or PUD orange over the tumor or defixation. N1 means mobile palpable axillary nodes and M1 means distant metastasis. Now, clinical features. These include general features like anorexia, weight loss, anemia, and local features like cancer commences most frequently in the upper outer quadrant. Inside there may be broad distant nipple discharge. Patients most presently present as the hard lump, which may be associated with indrawing of the nipple. Pain is late. As the disease advances, there may be skin involvement with PUD orange or frank ulceration and fixation to the chest wall. Lymphadenopathy may be present, which may be axillary or cervical. There may be edema of the hand on the affected site. Now, metastatic features like bone pain, chest pain, cough, hemoptysis, pleural effusion, abdominal swelling, sensory and psychological defects due to CNS metastasis. And the cardinal signs of the carcinoma of the breast includes stony hard irregular lump, tethering or fixation of the lump and palpable axillary lymph nodes. Investigations includes FNAC from the breast lump, excision and biopsy of the breast lump, and treatment includes mammography. Now, investigation for staging or distant metastasis includes chest X-ray, serum alkaline phosphatase, gamma glutamate transaminase, liver ultrasound, isotope bone scan. Principles of treatment: to cure the primary disease or control of the local disease in the breast and axilla, reducing the chance of the local occurrence, reduce the risk of the metastatic spread. Now, management of the operable breast cancer, achieving local control and appropriate surgery, which may be wide local excision or radiotherapy, combination of the axillary procedure, and treating of the systemic diseases if they are present. Now, treatment by staging. For stage 1, lumpectomy with 2 cm normal tissue. For stage 2, lumpectomy with axillary lymph node dissections preserving the pectoralis major. Simple mastectomy with axillary lymph node dissections preserving pectoralis major. Pattage mastectomy or lumpectomy or simple mastectomy combined with radiotherapy, which is the best treatment. For stage 3 and stage 4, palliative surgery with a simple mastectomy and hormone therapy and chemotherapy can be given. Now, modalities of the treatment of the breast carcinoma. It may be surgery, radiotherapy, stomach therapy, adjuvant, following surgery, neoadjuvant, before surgery, hormone therapy, chemotherapy, or combination as well as immunotherapy can be given. Now, non-surgical treatment of the carcinoma of the breast includes radiotherapy, adjuvant systemic therapy, hormone therapy by tamoxifen, and luteinizing hormone-releasing hormone agonist, which induce a reversible ovarian suppression. Chemotherapy using a regimen of 6 monthly cycle of cyclophosphamide, methotrexate, and 5-fluorouracil. Now, surgical treatment options for breast cancer includes mastectomy, which is simple, modified radical known as pattage mastectomy, or radical, which is Halsted mastectomy, or conservative surgery like coronectomy or wide local excision. Now, criteria for planning of the breast conserving surgery: olive breast cancer with lesser than 4 cm lump, clinically negative axillary node, breast of the adequate size to allow uniform doses of the radiation, facility for radiation therapy is available, patient compliance, patient willing to accept 10% chance of the local recurrence, and patient's consent for breast conservation therapy. Who are the candidates for the breast conservation therapy or surgery? Mammographically detected lesion, small size of the pituitary primary tumor lesser than 4 cm, and low S phase component in the DNA flow cytometry. Now, indications of the mastectomy: large tumors in relation to the size of the breast, central tumors beneath or involving the nipple, multifocal disease, local recurrence, and patient's preference. Indications of the mastectomy in early carcinoma of the breast: following lumpectomy or segmentectomy, resection lines are not free of the tumor. Multicentric disease, poorly differentiated tumor, patient's choice. Following breast conserving surgery, patient may worry about the risk of the local recurrence. Now, what is QUAT? QUAT is a quadranectomy, axillary dissection level 1 to 3, and postoperative radiotherapy. This concept has been popularized by Umberto from Millian. Quadranectomy: it is a form of the breast conserving surgery for early carcinoma of the breast. It in the entire segment of the breast containing the tumor is excised. It involves removing the entire segment of the breast which contains the tumor, and usually combined with the axillary surgery via separate incision in the axilla. What is simple mastectomy? The removal of the breast only with no dissection of the axilla except for the region of the axillary tail of the breast, which usually has attached to it a few nodes low in the anterior group. Patch mastectomy or modified radical mastectomy includes dissected in blocks that consists of the whole breast, a large portion of the skin, the center of which overlies the tumor, but also includes the nipple, all of the fat, fascia, and lymph nodes of the axilla. While local excision, it includes removal of the tumor with the rim of the normal breast tissue, usually combined with axillary surgery. Hostile mastectomy includes excision of breast, axillary lymph nodes, and pectoralis major and minor muscles. Breast cancer is screening for lesser than 40 years, biennial mammography and annual clinical examination. For 40 to 50 years, annual mammography and clinical examination. For more than 50 years, needs more frequent screening depending on the risks. End of the topic.
Screen. That